Hey everyone, welcome back to the channel. Today, I'm diving into a critical topic, ectopic pregnancy. Whether you're a medical student or someone just curious, understanding this condition is key. So let's break it down. First up, what exactly is an ectopic pregnancy? Simply put, it's when a fertilized egg implants outside the uterus, most commonly in the fallopian tubes. This isn't where it's supposed to be, and it can't develop into a viable pregnancy. Now, why is this a big deal? Well, the fallopian tubes aren't designed to hold a growing embryo, which can lead to severe complications. If left untreated, the tube can rupture, causing internal bleeding and severe pain. This is a medical emergency. So how can you spot an ectopic pregnancy? Early symptoms can be tricky because they mimic a normal pregnancy. Think nausea and missed periods. But there are some warning signs. Sharp abdominal pain, shoulder pain, and dizziness could signal trouble. If you see these, get medical help immediately. Diagnosis usually involves a combination of pelvic exams, ultrasounds, and blood tests. Doctors look for the hormone HCG, which usually rises in early pregnancy. If levels are lower than expected, it could be a red flag. Now let's talk treatment. Unfortunately, there's no way to save an ectopic pregnancy. The primary goal is to remove it before it causes serious harm. This can be done through medication like methotrexate, which stops cell growth and allows the body to absorb the pregnancy tissue. In more severe cases, surgery might be needed to remove the ectopic tissue. One more thing, can you prevent an ectopic pregnancy? Risk factors include a history of pelvic inflammatory disease, smoking, and previous ectopic pregnancies. While you can't eliminate all risks, being aware of them helps you stay vigilant. So that's the lowdown on ectopic pregnancy. It's a serious condition, but with early detection and prompt treatment, the risks can be managed. If you found this video helpful, don't forget to like and subscribe for more medical insights. Thanks for watching and see you in the next one.